This is the CT scan gallery. The CT scan revolutionized how we looked at the brain. Now, we can see through the skull at the tissues inside. Not only can we see the inside, but we also have the option to make 3D renderings of the scans. Here's a normal CT scan in the axial view, slices are top to bottom. Coronal view, slice is from the front to back. And the sagittal view, slices are from side to side. The brain is easily seen, as well as the interface between the gray and white matter. When looking for skull fractures, the image can be filtered for bone images and not the brain. Here's a bone window axial image through the area of the fracture. The 3D images are made from the scalp perspective. Here's a depressed skull fracture and another 3D image of a fracture on top of the head. CT images of gunshot wounds to the head show the extensive amount of injury that can occur from a high-velocity impact. Here's a CT scan of a suicide attempt. The bullet is lodged in the skull at the point of impact, as one can see from the metal interference on the scan. However, there is significant injury to the brain from the impact of the bullet, with bleeding seen as the whitened area in the brain. This scan shows a fatal gunshot wound with the bullet going through the brain. One can see the entrance wound and the exit wound. On impact, the bullet fragmented, and small fragments of the bullet can be seen scattered along the tract as dense white spots. The dark spots are air bubbles in the brain. This next scan shows a gunshot wound where the bullet enters on one side of the head but does not exit the head. The bullet itself can be seen as a metal artifact near the skull on the opposite side, with a trail of blood along its path. Bleeding into the brain or the skull can easily be seen on the scans. This first scan shows a hemorrhage in the brain itself. This bleeding is from a ruptured blood vessel. The next scan shows bleeding that is trapped between the skull and the coverings of the brain. This is known as an epidural hematoma. The edges of the hematoma are rounded, showing the coverings of the brain are being stripped away from the skull. Next is a subdural hematoma. Here, the blood is collecting between the brain and the skull, pushing the brain to the opposite side. Any hemorrhage in the brain is dangerous. The brain sits inside a box called the skull, and there's only so much room in the box. If you add a few ounces of blood into the skull, there is less room for the brain, so the brain gets squeezed over to the opposite side. Since the bleeding takes place in a matter of minutes, the brain has no chance to accommodate for the pressure, and the injury can easily become fatal. Tumors, on the other hand, can grow slowly over time. This allows the brain an opportunity to move and accommodate the tumor growth. Some infiltrating tumors can grow to significant sizes before causing problems. Contrast material was used to identify the tumor cells more easily, as these cells picked up the contrast and the normal brain cells did not. An angiogram can be done with the CT scanner. The image can then be rendered in a 3D conformation for better visualization for the surgeon to plan the surgery. Here is an image of a digital subtraction angiogram and a 3D rendering of the CT image of the same vasculature. An arteriovenous malformation, or AVM, is a tangle of blood vessels that links an artery directly to a vein without the intervening capillary system. This places high-pressure blood flow of an artery directly into the low-pressure venous system. An angiogram of the AVM can show not only the blood vessels involved, but the intervening brain tissue as well. This ends the CT scan gallery.